Hi everyone, my name is Richard Holley and I'm the Area Manager for the Northamptonshire Stop Smoking Service. I also lead on tobacco control for Public Health Northamptonshire. So first of all, I'd just like to say thank you really to the organisers of this event for allowing me to come and talk about smoking cessation and being able to highlight just how much of an important issue it still is in 2021, and also being able to promote the level of support that is available to local smokers. So smoking is still the leading cause of preventable death and ill health in the United Kingdom. And in England alone, there are 80,000 deaths that are directly caused from smoking every year. So 80,000, that's more than the next 6 biggest causes of preventable death combined. So 72% of lung cancer cases can be attributable to smoking. Likewise, 90% of COPD cases can be attributable to smoking. And 1 out of every 2 lifelong smokers will tragically die from a smoking-related condition. And those lifelong smokers can expect to lose around 11 minutes of their life for every cigarette that they smoke. So whilst we've made really big strides in smoking over the last kind of 10, 15 years, in terms of reducing the number of smokers, there's still lots of work to do. There are about 6 to 7 million smokers in England still, and we all need to kind of play a part in helping to reduce that number. So what does this mean for the healthcare system? What does this mean for the NHS? Well, smoking places an enormous burden at almost every level of the healthcare system. If you look at secondary care, almost 500,000 hospital admissions every single year are directly caused as a result of a smoking-related illness. And around 25% of hospital beds in the country are taken up by smokers. At a primary care level, millions of prescriptions are made and appointments had every single year, which wouldn't be needed at all if we could reduce the number of smokers. Now, all of this culminates into an annual cost to the NHS of about 2.4 billion. Now, to put that into context, it costs around that to run the NHS in its entirety for a week. So these are enormous figures that are entirely avoidable. But of course, the damaging effects of smoking aren't limited rather to the healthcare system. They also damage the economy. Smokers tend to take more breaks, so they're potentially less productive, having smoking breaks, which cost £3.3 billion every year to the economy. They are more likely to have extended periods off of work due to ill health. They're also more likely to retire earlier due to ill health and require care once they retire. For every 1 smoker that dies from a smoking-related condition, 30 require some form of care, and that's often provided by either a local authority or a friend or a family member. So there are significant knock-on effects from being a smoker and having to retire earlier and having poorer health sooner than your non-smoking counterparts. For the individual, smoking is also an enormous financial burden. So the average smoker spends £2,050 every single year on tobacco. Smoking literally keeps people below the poverty line. And by reducing the number of smokers, we are ultimately elevating people above that line, which of course we would love to do. Now, the overall cost to society as a whole by smoking is £12.9 billion every year. So you will often hear people say that maybe smoking generates more money than it actually costs. And that's true when you look at the NHS, but when you look at society as a whole and the effect that smoking has on loss of productivity and the direct cost from smoking-related house fires and things like that, when all that's clumped together, it pales into comparison. And we're still about £5 billion off rather than being anywhere near what that overall cost is. So who is actually still smoking? Well, this is a very important issue because whilst we've reduced the number of smokers across the country, the rate of which that decline has occurred isn't evenly distributed. So there are lots of groups in which smoking is still very prevalent, far more prevalent than it is within the general population, who smoke around about 13.9% continue to smoke. So Sharon Cox very eloquently wrote about this in a recent article in the British Medical Journal, and I just wanted to include this quote because it makes quite an impactful statement. So today, around 200 people die from smoking in Britain alone. So this is often compared to a plane of smokers crashing down every day. This makes for a powerful metaphor, but it needs updating because where these planes fall and who the passengers are is not evenly distributed. So who are these groups? Well, I wanted to highlight just 3 of them today, so you can kind of see who Sharon was referencing. So the first of which is routine manual workers. So routine and manual workers smoke in much greater numbers than their managerial and professional counterparts. So routine manual workers smoke at a rate of 23.2%, whereas only 9.3% of people who work in managerial and professional roles do. However, what's really important to remember is that if you are a routine manual worker, you're no less likely to want to quit, but you sadly are less likely to succeed. The next group are people with a mental health condition who smoke, again, in much higher numbers than people who don't have a mental health condition. And it's that behaviour, being a smoker as someone with a mental health condition, that explains, partly explains at least, the difference in life expectancy between people who have a mental health condition and those who don't. And the more serious your mental health condition, the more likely it is that you're going to smoke. So the last one is people who are experiencing homelessness. So of all the groups, people experiencing homelessness tend to smoke in the greatest numbers. So 70% of people experiencing homelessness are smokers, which really explains why they are much more likely to develop some kind of respiratory disease and potentially die from it. So I'm sure you'll all agree that all of these are huge injustices that we definitely need to tackle. And one thing that we can do in Northamptonshire is create links between people who work with these kind of groups and potentially the Stop Smoking Service. So if by any chance you work for a company who has a very large number of routine and manual workers in your workforce, then by all means get in touch and we can perhaps do some work with you. Similarly, if you work for a charity who works with people with a mental health condition or with the homeless population of Northamptonshire, we can also potentially do some work there. So by all means, get in touch if you work with any of these groups, because certainly over the next year or so, we want to start tackling these groups in which smoking is highly concentrated in a much more effective and efficient manner. So speaking of Northamptonshire, so what's the current landscape for smoking in our county? So we have about 96,000 smokers in Northants. So our smoking prevalence is 16.4%. So that's higher than the national average, only just, but it's similar to the regional average. But there are pockets in which we have a much higher prevalence than the kind of national and the regional averages. So if you go down to South Northamptonshire, for example, smoking prevalence there is less than 7%, which is fantastic. But if you travel, an hour up the road to Corby, you'll see that people smoke in much greater numbers. 27.5% of the population of Corby are smokers. Now that's the highest smoking prevalence in England, and Corby's had that title a couple of times. And not far behind it, places like Wellingborough and Northampton also have rates a lot higher than everywhere else, or rather the national average at least. So Northamptonshire smokers are also burdened financially by smoking. So your average smoker in our county spends around £170 every single month on tobacco. That's a lot of money I imagine, for most people to find. Also in Northamptonshire, fire and rescue will attend more than 30 smoking-related incidents every single year, which obviously places a huge financial burden on them. And also, of course, there are deaths quite regularly from smoking-related house fires. And the overall cost of smoking in Northamptonshire to society is £160 million every single year. So what exactly is the solution? What can we do about this? Well, nationally, there are a few things that the government are trying to drive forward and smoking cessation advocates. So one of the approaches that could be taken is a polluter pays approach. So there's a huge drive to make the tobacco industry pay for the harm that they're doing, to ensure that people who would like to stop have access to stop smoking services and efficient tobacco dependency treatment. So there's a big, a big drive to improve treatment services that focus on dependency. So trying to move away from seeing smoking as a character flaw, and instead looking at it as an addiction, as a dependency. There's also a push to advocate for healthy alternatives. So Public Health England are very much advocates of harm reduction and vaping. They think that vaping can play an important role in helping us reduce the number of smokers. And also price increases. It's proven that increased costs of cigarettes has a very beneficial effect, particularly to the people in more deprived communities, and it reduces the number of people that are smoking. So what about locally? What can we do locally? And what's kind of already taking place? Well, there's a few very positive things. Really, what we're trying to do is ensure that people take a very kind of making every contact count approach to smoking cessation and tobacco control, ensuring that people who are having conversations, especially with those target groups that I mentioned, are always keeping smoking at the back of their mind, trying to ensure, well, really trying to capitalize on any opportunity to encourage a quit attempt. And we can do that by actually training people. So the Northamptonshire Stop Smoking Service provides brief advice training to local organisations, again, especially people who work with our target groups, which allows you to kind of understand how to broach the topic, how to discuss smoking, understand what the local offer is, how to refer, to get, to comprehend what you're referring to, and to be able to sell it as an opportunity to smokers. I would also encourage people to engage with the Northamptonshire Tobacco Control Alliance. So I chair the Tobacco Control Alliance, and we are a group of organisations who have a vested interest in reducing the number of smokers in Northamptonshire. So we have representation from housing, so we have trading standards as well, fire and rescue, representatives from Northampton and Kettering General Hospitals, a whole host of people who try and contribute, and each bring something very valuable to the table. I would also say that we need to raise awareness of the support that's available to local smokers. As I've mentioned, the Stop Smoking Service can provide training to allow you to do that. I would say one of the things that the service hasn't been great at over the last few years is kind of getting the word out there. So whilst we're doing that ourselves and increasing our marketing efforts internally, we're also wanting to engage with organisations who can promote us as well, because as my previous slides have kind of demonstrated, reducing the number of smokers is really in everybody's best interests in Northamptonshire. So we are also advocates for harm reduction, and there is a really big push locally, certainly from the Tobacco Control Alliance's efforts, to highlight the benefits that vaping can play in reducing the number of smokers in our county. So speaking of which, I did just want to cover a couple of things on vaping because it's a very hot topic, and there's some real misperceptions around e-cigarettes and the kind of risks that they pose versus the plethora of rewards. So what exactly is an e-cigarette? So an e-cigarette is an electronic device that vaporizes nicotine into an inhalable form. So they were developed back in China in the early 2000s, and they really started taking off in England around the 2012 mark. That's when we started seeing the numbers increase quite significantly. And they are now the most popular way of stopping smoking in the United Kingdom. They're most commonly used as a way to stop smoking, but they are also used by some people to just simply reduce the amount of combustible tobacco that's smoked. And I'm pleased to say they're incredibly effective at doing both of those things. They have been found to be twice as effective as other nicotine replacement therapy, things like patches, gum. Even after 12 months, you're much more likely to still be smoke-free after 12 months if you use an e-cigarette versus some of the other products that have historically been provided. So back in 2015, Public Health England made a very bold statement around vaping, and that was that e-cigarettes, vaping is 95% less harmful than smoking. So those evidence reviews are taking place every single year. So Public Health England keep up to date with all of the latest evidence, review it, and see if they can continue to make that statement. And I'm pleased to say that that statement hasn't changed since it was made in 2015. So the message is very clear: e-cigarettes are less harmful than smoking. And smokers who have perhaps struggled in the past to quit smoking entirely, or people who aren't ready to stop using nicotine yet, switching to vaping is a very wise move. Anybody that's listening to this that is a smoker, I would encourage you to switch to vaping as soon as you possibly can. So one of the most beneficial aspects of e-cigarettes is that there's no combustion. The majority of the harm associated with combustible tobacco occurs because you have lit something on fire and you're inhaling the smoke. Because there's no combustion, there's no carbon monoxide. Carbon monoxide is a poisonous gas that displaces oxygen in your blood, so your heart has to work a lot harder to pump the oxygenated blood around your body. With e-cigarettes, there is no carbon monoxide, so the strain on the heart is reduced, significantly reduced, almost eliminated entirely. So that is probably one of the biggest benefits of switching to vaping. E-cigarettes, the e-liquid that you put within your vape as well, contains no carcinogens. So being able to switch is a very positive thing, and as I mentioned, very effective. Now, e-cigarettes are used almost exclusively by smokers or former smokers. One of the concerns around vaping in the early days was that it might potentially lead people who had no interest in or history of smoking into using nicotine and then potentially starting to smoke. Thankfully, that hasn't happened. It is incredibly rare for people without a smoking history to take up vaping, and that's a very positive thing. Now, one thing that has declined over recent years is the kind of viewpoint of vaping from the smoker's perspective. So perception of harm has got gradually worse amongst smokers, despite the evidence suggesting that it's actually that e-cigarettes are significantly less harmful than combustible tobacco. So if you have a look at the table on screen now, so what I would like you to pay close attention to is the orange bar within this chart. So that details the percentage of smokers who believe that e-cigarettes are more or equally as harmful as combustible cigarettes. So as you can see, in 2013, 8% of smokers felt that e-cigarettes were more or equally harmful, and as you can see, this has gotten gradually worse over recent years, peaking in 2020, where more than 1 in 3 smokers erroneously felt that vaping was more or as harmful as smoking. So this is a real problem, and I think we all have a role to play in addressing these misperceptions around e-cigarettes, because, as I mentioned, switching to an e-cigarette from combustible tobacco is really a good thing. It should be encouraged by everybody across the health sector and across all other sectors as well. So we are keen advocates of harm reduction in Northamptonshire. Harm reduction plays a role in various other aspects of our life. We wear a seatbelt when we drive a car. We wear a face mask when we go shopping at the moment. All of these things don't eliminate risk entirely, and it would be foolish to think that they did, but they reduce risk, and we need to have the same approach when it comes to smoking. So what level of support is actually available to local smokers? So in Northamptonshire, we are very lucky. We have a very effective and efficient Stop Smoking Service who have a very generous offer compared to a lot of the other areas in the country. Some areas in England don't even have a Stop Smoking Service, and we have one that provides 12 weeks of free specialist support. Now that features tips and advice on how to quit and how to stay quit, most importantly. All of it's currently done over the phone. We are conducting telephone appointments. We have done face-to-face work in the past, but of course that came to an end March of last year, and we haven't restarted that up again. But telephone appointments have been very popular. We're very pleased that over the last year we've been able to continue providing support to our residents who have simply not been able to leave the house. So we're very grateful that we've been able to do that. So as part of our program of support, you can also access nicotine replacement therapy. So that's things like patches, gum, lozenges, mouth spray, many of the things that you can get from the shop, but through the Stop Smoking Service, you can get it free of charge. We don't ask for any payment for any of our nicotine replacement therapy or our e-cigarettes. So we can send you e-cigarettes, nicotine replacement therapy direct to your door at absolutely no cost when you engage with our service. We can also offer a Champix referral. So for those of you that don't know, Champix is a controlled medication that is prescribable. So it's prescribed by commonly GPs or pharmacies. So again, we actually don't request that you go to your GP if you would like to partake in a course of Champix. We have a network of pharmacists that can help you if you're eligible to be in a course. So our overall package it's very broad, and I'm very proud of what we've been able to create, because it's extensive, it's generous, and it's of a very high quality. So the last kind of year has been quite transformative for us, and we kind of relaunched the service almost last April, where we brought the service back in-house. We expanded the size of the team, improved the offer that was available. Of course, we added e-cigarettes, which again I'm very proud of, and has proven very, very successful. And we also conducted some client surveys over the last couple of months, and we've got some very nice feedback that I'd like to share with you, because it's feedback that I'm very happy about. We've worked really tirelessly over the last year or so to create a service that's far more effective, very consistent in the support that it provides, and it's just more equitable across the board. So if you would like to access the Northamptonshire Stop Smoking Service, there are a few ways of doing it. So you can give us a call on 0300 126 5700. You can email us at smokefree@northants.gov.uk, or you can check us out on Facebook and Twitter. We're at smokefreenn1. So in conclusion, smoking is still a very serious issue. Smoking has killed more people than COVID over the last year. It's the leading cause of preventable death and ill health, and it impacts a broad variety of sectors and people, kind of across the board. It disproportionately affects certain societal groups, as I mentioned, people with routine and manual workers, those with a mental health condition, people who are experiencing homelessness. These are injustices that we can solve, and that you can help us solve. So smoking is, of course, very detrimental to the people and the county of Northamptonshire. As I mentioned, smoking kills around 1,000 people in Northamptonshire every year and costs an absolute fortune for us. But as I mentioned, solutions exist. There's lots being done nationally, and there's a lot being done locally that many of you, I'm sure, will want to get involved with. And of course, as I've mentioned, support is available for local smokers. So I would encourage everybody to refer people, get referring, start having those conversations. If you'd like us to train you, by all means get in touch, and we can show you exactly how to start those conversations up and to provide you with a bit of knowledge around smoking cessation that will enable you to help your clients or your friends and family, or potentially yourself, stop smoking. So that's pretty much it from me today. So obviously, if you have any questions, my email address is on screen now. Please check us out on our Facebook and Twitter pages. And yeah, help us reach more smokers and get the word out there about our service. Well, thank you very much for listening, and enjoy the rest of the festival. And hopefully I'll be speaking to you all soon.